Good morning and welcome all of you to the Healthy Conversation. Today we are going to talk about a very common problem known as leg edema or leg swelling. This has plagued the humanity since its beginning. So it's not a new problem to have, but it is one of the least understood and badly managed problem. So what is leg edema? Basically, leg edema is an abnormal buildup of fluid anywhere in the body. So can it be something else? Whatever swells is not edema. It may be something like fat, it could be fibrosis, it could be tissue, but not all the legs that swell is edematous. So that's an important thing to remember, that not every leg that swells is edematous. So looking at this leg, a 55-year-old female says, my legs are swollen. Now, do you think these legs are swollen? Probably not. If you look at her legs, and especially in the lower part of the feet behind the ankles, there is a hollows there. So whenever there are hollows there, it's less likely to be swollen. And many people tend to have something that we call a different distribution of fat in the body. A lot of the time what we call swelling could be simply like a fat. The new picture that you see on the left side is that of a baby. So do you think these legs are swollen in the baby? No, this is baby fat. So a lot of time when we say that my legs are swollen, they may not be swollen. There is another problem, is to recognize the earliest signs of swelling, earliest sign of fluid in the body. So if you look at this leg on the left side, you can see that there are hollows on either side of the back of the ankle bone. So it's less likely that there will be some swelling in the leg, because by gravity, the fluid is going to follow the lowest part of the leg. And when there is a swelling in this part of the leg, first of all, the hollows get filled up. How about the second one? It appears that there is no more hollows there. So it's probably this patient has a swollen leg. Even though the contours are maintained, even though that from outside, it doesn't look like that it is swollen. However, if the same person, he wears a socks, and at the end of the day, he will see a line in the top of the socks, and that is an indirect sign that the legs are swollen. Swelling, whether it is small, mild, or large, or extremely large, it has implications pretty much to the same extent, and depending on what is the reason for swelling. It's important to recognize these early signs of swelling. Now, how about this leg? It's a little more swollen than the first and the second one. So there are different ways to find out if the leg is swollen. Okay, there's another spectrum of the problem, is that when somebody says, okay, I don't have any swelling, and this is common. This is more common than saying that I have swelling. So if you look at the leg, there is a loss of contour on the leg. However, the best thing in this situation is to do something like that we call a thumb test. You just press the thumb against the bone for around 10 seconds, a little pressure more than normal, you will see a dimple there. And that's how you find that their legs are swollen. Just the leg edema is not a visual diagnosis. It's by palpation that you find it. Again, sometimes the swelling could be predominantly involving the area in the ankle. And this is a patient who has extensive skin changes because of the edema. If you look, the skin looks like scaly, and there's a loss of hairs, there's some pigmentation there. This is more advanced than the previous patient. So coming to the next slide, which is about how do we scale edema, and do we need to scale edema? So sometimes we there's a scale, and we go from 1+ to 4+ to call whether the leg, how much is the edema there. In general, it does not have much implications unless we are following a patient from day 1 to day 10 or day 50 to know how his swelling is responding. Most of the time, a leg circumference is needed, a body weight is needed, and there are other parameters also needed. So a leg edema scale is just a visual representation of looking at the swelling. Now, when it comes to leg swelling, there could be multiple reasons for leg swelling. It could be possible that it could be a life-threatening problem, and it could be possible that it's a completely benign problem, and it's possible that there's nothing there at all. So how do we work up? Leg edema workup is very essential, and essentially what it involves is a good sense of internal medicine, family medicine, and a lot of different fields of the practice more than anything else. And if that connects to something with a knowledge of vascular medicine and imaging, so knowing the hemodynamics and the basic principles of how to diagnose it, it helps a lot in diagnosing these, especially some of the rare causes of leg edema. We start with a simple thing, which is known as the history-taking physical examination, and we try to look at specifically when did the swelling start? Was it acute onset, which means it started within last week, or has it been there off and on for many years, or has it been there all the time and it's gradually progressing now? So the onset is very important. Is it involving one leg or two legs, or is it, are we able to make a dent by putting a pressure known as pitting or not? We'll look at different type of associated signs like skin changes, like wounds. If they are happening, what are the changes in the nails? And so we look at, the patient is looked at the whole. So we try to find out what are the chronic problems, so medical problems, what are the medications, what are the, how is the mobility. So there are multiple factors involved in evaluation of a swelling. This follows some blood work, some imaging, and especially ultrasounds, which is very important to diagnose the swelling. So when it comes to looking for the different reasons for leg edema, again, I would like to emphasize that what is more important is whether the swelling is in one leg or two legs. Does it only involve the ankles? Does it involve the ankles as well as the feet? Or does it involve the ankles more than the lower leg, or lower leg more than the ankles, or it involves the whole leg, and does it extend all the way to the abdomen? So there are multiple reasons to know. And does the patient have swelling over the hands? Does the patient have swelling over the face? So multiple factors are required to finally pick up what is the reason for leg edema. When it comes to leg edema, the number one reason for leg swelling is chronic venous insufficiency, which is a topic we covered in our recent Healthy Conversations last month. And it was an extensive presentation. You can go to the link on YRMC Health Connect, and you can find more details about chronic venous insufficiency, because it's such a common disorder and it exists with the chronic edema. Edema is not a diagnosis, it's a symptom. What causes edema is more important. So the number one reason is chronic venous insufficiency. Most of the patients who have leg swelling, they may have associated varicose veins, which may be visible. Sometimes the varicose veins are not seen. However, they may have skin changes that we call stasis dermatitis or eczema-like lesions in the skin. They may have leg ulcers, they may have leg itching and cramps and leg pain. So it's not very difficult clinically to diagnose somebody has chronic venous insufficiency or not. The next thing is to look for any other reasons for leg edema. So one of the most important reasons that could be concerning is a situation that can develop in patients who have underlying chronic venous insufficiency or who may not have it, is known as a blood clot in the deep system, known as deep venous thrombosis. And this is an emergency. If somebody has a swelling leg that swells up overnight in the last 1 week and it pains, it's most likely a clot in the deep system, and it's important to go to the emergency room and get diagnosed as soon as possible. The second thing that we need to know is there are some other different reasons for having leg swelling. Most common is different type of system failures. Heart failure, which could be of multiple types. Heart failure with low ejection fraction, which is also known as a systolic heart failure with normal ejection fraction, also known as diastolic heart failure, chronic constrictive pericarditis, which means there is calcium deposition and thickening around the heart so that the heart cannot expand anymore. It could be a right-sided heart failure and pulmonary hypertension, which is more seen in people who have chronic lung problems. We see all of them at the vein center, and it's important to diagnose them because the primary treatment for leg swelling is the treatment of the underlying condition. There are some rare causes of leg swelling, but other than the venous insufficiency, which is 5 times more common than heart failure, which is the second most condition, there could be hypothyroidism, there could be liver failure, there could be an issue with the proteins, or an issue with the kidney function, or it could be lymphedema. Now, another one common reason for having leg swelling is the medications, and especially when it comes to managing a population which is more than 50 years of age, the first rule is the medication causing it or not? So for anything that, if there is a lack of sleep, if there is a back pain, we always look for, could it be somehow related to something that medications were started recently or not. Top of the list of the medication is the ones that are used for high blood pressure. And amongst them, the specific class of calcium channel blockers cause a lot of swelling in the leg. Almost any hypertensive agent causes leg swelling. And calcium channel blockers are the common one. Minoxidil, beta blockers, and hydralazine, clonidine, or almost methyl dopa, all of them have caused leg swelling. Other common reason to have leg swelling is use of painkillers. That is something that we call non-steroidal anti-inflammatory agents. So they can also cause an indirect change in the kidney function, leading to leg swelling. Especially in the young age, when somebody presents with a blood clot in the leg, we always look for something that is known as a hormone replacement, or something that that might be an over-the-counter contraceptive pill that can cause the leg edema. However, in the elderly population, corticosteroids, hormone replacement, and even testosterones that can also cause leg swelling. It's important to know all of these reasons, because they are simply removal of the medication is the treatment for them, or changing the medication to something else which is more effective. Again, some of the diabetic medications, which is again a common problem, can cause leg swelling. The antidepressants, anti-cancer medications, and anti-Parkinson's medications, they can all cause leg swelling. If you look at, these are the common problems that we see on a daily basis. So to find out that the leg swelling is coming out of medication, or it is coming because of chronic venous insufficiency, or heart failure, or lymphedema, it's kind of a different acumen and scale. We try to combine everything together to find out, because there could be a combination of problems. It could be possible that there are 2 or 3 problems acting to cause the same problem. Now, coming to little about the calcium channel blockers, especially amlodipine, it's known to cause leg swelling in almost 25% of people who take 10 milligrams a day. It's a common antihypertensive medication. The main mechanism of its action is causing dilatation of the arterial side of the capillary network. So it only acts on one side and makes it big. So by doing that, it decreases the blood pressure. However, it causes a change in the function of the kidneys, which basically means less blood flow in the kidneys, which causes indirectly, which causes leg swelling. So what do you think would be the best thing to do in such a situation? Should we give a water pill or something that we call diuretic to somebody who swell with a calcium channel blocker or not? Obviously no, because if somebody's edema is coming up because of an effect of the kidney function, it's only going to deteriorate it further. Sometimes the leg may look visually better after a water pill is given, but the kidney function deteriorates. And many times it's not even checked, but long term it causes a long-term problem. Now, what is the best treatment for such a situation? And the best treatment is to do something, one, to stop the medication, of course, or to do something that can have an opposite effect. So it affects the venous side. And there's a class of medication known as ARBs, or the RAS inhibitors. So commonly known as a medication known as losartan, which is commonly given for hypertension, is the best solution because it dilates the venous side also. So that combination works very well for hypertension. Like we know that hypertension is not an easy thing to control, and many times we have to give 4 and 5 medications to control the blood pressure. It's the right combination that helps the most. So it's helping, knowing these functions help us choose the right medication for the patient. And if you think about it, if the diuretics were given in this situation, it only causes harm. Now, what is the next common cause of swelling in the leg? And it's lymphedema. Lymphedema is one of the most undiagnosed, least diagnosed, least treated diagnoses. Mainly because of the reason that when we are in med school or residencies or fellowship, combinedly, not more than 30 minutes is present in the curriculum, which can go from anywhere from 5 years to 10 years. not more than 30 minutes is spent on educating about lymphedema. That's one of the reasons. And most people, they suffer in silence. And most people get depressed. They get physical suffering because of these. There is deformity of the leg, but they don't get to treat it because they don't never get diagnosed. And that's one of the reasons that at the vein center, we have combined with the lymphedema therapist to tackle this problem as a combined in a common spirit. Now, coming to the circulation, there are 3 types of circulations. It's not 2, just not the arteries and the veins. And the most extensive circulation actually is the lymphatic circulation. The role of lymphatics is to take fluid and proteins back to the heart. And essentially, this is something that is lesser known than it was in the past, because we always were brought up thinking that it is the venous side that takes all the blood back to the heart. The lymphatic circulation is very, very extensive. It starts from just below the dermis to all the way to the deeper aspects of the leg. And it's a network which is thousands of times thinner than a hair, and from where the absorption happens. So a little changes in the skin anatomy, just like infection or swelling, can derange that uptake of lymphatic fluid. So it's important to recognize that edema is not a diagnosis, it's a symptom. However, lymphedema is a diagnosis which is progressive with no cure and has a lot of suffering. So, like I said, the Starling's principle, which is more than 100 years old, and is still taught in the medical schools, which simply means based on the pressure inside the vessel and outside the vessel is how the exchange is happening. And more than 90% of the fluid gets absorbed through the venous circulation, has been challenged. And the latest thought process is that almost all of the absorption occurs from the lymphatic circulation. It's important to know this is an evolving science, it's an evolving field, it's a big change in the thought process in the treatment and management of lymphedema and edema in general. So what happens when the leg is swollen because of lymphedema, the lymphatic fluid, the fluid is collecting in the legs, it leads to a spiral of events. It causes the legs to become pigmented, it causes the legs to become thickened, indurated, and inflamed. There are recurrent infections because lymphedema means lymphatic fluid is also important for the immune function of the body. It's not only for taking the fluid and proteins back to the heart. So it continuously makes a spiral, because once an infection sets in or edema sets in, it further impairs the lymphatic function, and the cycle keeps on going. It can lead to ulcers and sometimes even limb loss. It is very important to recognize that the vein and the lymphatics is basically the one thing. When there is a swollen leg, it simply means there is an inability of the lymphatic drainage to clear the leg of that fluid. So most people who have vein disorders in the long run, when they have leg swelling, they already have the lymphatic dysfunction. There is a reason there's a new term that is known as phlebo, which means vein, and lymphedema. So this is a real diagnosis, and it's a very common cause of leg edema. It was possible in the coming literature, it will become the #1 cause of leg edema. Right now, when it comes to lymphedema, phlebolymphedema is the #1 cause, and the second one is cancer for having edema in the leg. We can diagnose the lymphatic dysfunction by doing a simple infrared fluoroscopy, infrared imaging, and we can see that people who do not have any swelling, but they have a venous ulcer, they already have a significant lymphatic dysfunction there. So even if the leg is not swollen, they still have lymphatic dysfunction. And this is an important landmark in the history of knowledge about edema and the continuing of its progressiveness of its nature. So the legs become so swollen and thickened and indurated and pigmented, and it is basically a continuum of the whole process. So well, if you look at this slide, and you can see that there are various conditions which can be simply like obesity, metabolic syndrome, people who have burns, hemorrhagic shock, different type of illnesses that happen in diabetics, not only venous insufficiency, chronic infections, different type of cancers, in peritonitis, which is a problem of having fluid in the belly. All of them have one thing in common, and that is an impaired lymphatic function. So coming to the causes of lymphedema, we know there could be primary, which simply means there's a defect in the growth of the lymphatic system, which can present right at the childhood, later in the puberty, or maybe sometimes a late onset. Now, there is a secondary cause, as I said. The number one reason is chronic venous insufficiency. Number two reason is cancers, and other reasons are any trauma in the leg. One of the commonest things that we see after any surgery, especially the knee surgery, is the swelling in the leg. The swelling in the leg is basically phlebolymphedema, and it's not a pain-induced dysfunction, or it's not because of any other reason. It's just that there's a damage to the lymphatic whenever there is a trauma to the leg. There is a discontinuation of the lymphatic flow. There is immobility. There is pain. All of these combined together cause venous stasis, which causes increased pressure in the leg, causing the swelling, which is basically nothing else but lymphatic dysfunction. One of the common reasons, like I said before, is obesity. Now, obesity, it's very difficult to appreciate whether in an obese individual, whether the leg is swollen or not. Of course, the thumb test will help. Sometimes the swelling is not there all the time. It is intermittent. It may be seen only at the end of the day or after travels. So it's important to keep a picture of those legs when you come to your doctor. So you bring the picture when it was swollen the most. So many times in obesity, there is underlying sleep apnea. There are multiple patients in the last 4 years that I have diagnosed as undiagnosed sleep apnea, which can affect the heart, which can affect many other functions in the body, just because they presented with swelling. So there could be pressure on the right side of the heart that could be causing the swelling. So there are different reasons in obese individual why there is swelling. It could be lack of mobility. Most common, one of the other common thing is back pain. When there is a back pain, almost a lot of people that I see have like swelling, they also have concomitant back pain. So back pain leads to less mobility. Less mobility leads to venous stasis. Venous stasis leads to edema. And it's not that most of these patients, when they present to us with leg swelling, more than 80% of them, they do not need any venous surgeries or any procedures or any interventions. All they need is education about how this swelling is happening. We spend a lot of time educating about this aspect, why there is swelling in the leg after we diagnose it. And then it's all about changing the main reason. So if there is a lack of mobility, we work towards increasing the mobility. If obesity is the reason, then we have to educate, we work towards causing weight loss and finding any reason why the weight loss is not happening. So it's basically a teamwork which takes care of the edema patients. It's not a single provider work. It's a multiple specialty. It's a team. Whenever the leg swelling goes to something that we call chronic progressive stage, one person is not enough to handle these things. Now, the second thing is we always try to look at what stage that lymphedema is. And in the worst of the stage, the skin becomes very thickened, indurated, the leg becomes bigger in size, and it is deformed. There is hyperplasia, hypertrophy, there is hyperpigmentation, there could be nodules in the leg, there could be recurrent ulcers. Most of the time, edema that happens in lymphedema causes fluid-filled blisters, and those blisters are open up and they become open ulcers, they get infected, they cause swelling, which makes the edema worse. So it's a whole spiral. So looking at this leg, if you look on the one on the left side, there's a lot of nodules. These are papules and nodules that are secondary to, there's more growth of the tissue. Even the adipose tissue grows more in a lymphedematous leg because behind the skin, there's a lot of things that are happening, and all of them lead to increase in the size of the leg, causes deformity in the leg, and in these, there could even be changes in the skin, in the nails, and this is something that we call ski jump nails. So they look upwards. There could be depression there could be thickening of the nails also. There could be chronic infection, fungal infection looking nails, which may just be related with lymphedema. Sometimes you see yellow nails, and that could be a different cause of lymphedema. So a nail examination, one of the most important things that we do when we look at the edematous leg is to look in between the toes. We look in between the toes for looking for a little tiny crack, which could be the seat of cellulitis. That could be the reason why patients keep getting admitted for infection, and just treating that little crack in the inside the two toes could be all that is needed to decrease those admissions, recurrent admissions. So foot care is very, very important, and skin care is very important for people who have chronic edema. Now, the edema could also be related to something which is common but hardly diagnosed. And this is an adipose tissue or a fat disorder which runs in the family, known as lipedema. It has nothing to do with the cholesterol level in the body. It is not a dyslipidemia, which is a disorder of the lipids in the blood. Lipedema is a genetic condition. It almost exclusively, but not completely, only affects the females, but it can be seen in the males on hormone replacement. It is usually symmetrical, and it basically what it leads to is a deformity which starts sometimes in the high school, and you see those athletic kids with a thin waist and a bigger size of the thighs and the buttocks. That could be the initial start of the lipedema. It does not affect anything at that time except for the common diagnosis of a chubby high school kid. But it slowly progresses to something that we can call advanced form of lipedema, where there is more adipose tissue in the thigh area and the lower legs. It may also have a form in which the upper arms are also edema, also have more fat or adipose tissue. This is a progressive problem. This is something that can be described as a pear-shaped type of a distribution, in which the waist is thin, unlike obesity, where the waist is affected very commonly. And so this is not obesity. So you cannot starve. You cannot decrease the fat in lipedema by starving, by taking less carbohydrates, or by doing a Atkins diet, or by keto diet or something, because this is a genetic condition. This is distribution of the adipose tissue. It has nothing to do with what we eat. Of course, if there is it can be combined with adipose tissue. Most of the time, it is a disorder which affects the smaller capillaries and vessels. It involves a disease that involves the small nerves. It involves the small arterioles, small venules. All of these get affected, so that they are inflamed, and the skin is tender to touch. The feet are in general spared, something that can look like a pantaloon legs. There could be more tissue around the malleolus, which is the ankles, and it could be, but the feet are currently likely spared. This is also associated with a disease that affects the bones. So lipedema is not just about the adipose tissue distribution. It affects the vessels, it affects the nerves. There could be numbness, there could be tingling in the lower legs. Often there could be nighttime symptoms, and there could also be a deformity of the bones, something that we call knock knees or hyperextension of the joints. So this is a real thing. It's in one of the studies, population studies, it was noted that 11% of females in the United States could be suffering from a condition like that. It's something important to recognize, and that could be all. It can be taken care after that by a specialist who's trained in treatment of lipedema. So like I said, the fat distribution is not just about the distribution. It goes constant and continuous progressive decline and atrophy and hyperplasia. It can lead to something that can look like lymphedema, but it is not lymphedema. This is classical lipedema that progresses. This is the same person over different ages of life. There is a society known as the Fat Disorder Society, which does a lot of education about these common illnesses, which can look like edema. At the Vein Center also, we spend time teaching about this entity and help the individual. Now, how does the lipedema different from lymphedema? Usually lipedema is symmetrical and it spares the feet, but lymphedema can be in 1 or 2 legs. Now, how do we treat some of these problems? So the problems start from diagnosing. The management is basically dependent on the diagnosis. And once we make the particular diagnosis, and that should drive the treatment. So for example, if you find that heart failure is predominantly the reason for leg swelling, then we treat the heart failure component. And if the chronic venous insufficiency is the reason for swelling, then we treat the chronic venous insufficiency, which predominantly is a conservative treatment by changing the lifestyle, by changing, by educating about it, by talking about compression, different types of compression therapy, by teaching feet exercises, leg elevations, and this is done routinely at the vein center. Then we talk about when it comes to lymphedema, there's a whole lot of stuff that is needed to help the individual live a progressively meaningful and a pain-free life. The compression therapy, like we talked about in our last presentation, and possibly in the coming healthy conversations, we can take up a whole lecture only on compression therapy, since edema is a common problem, is that it can be something from socks, compression socks that can be just covering the ankles. It could be knee high, it could be thigh high, it could be pantyhose. It could involve a different material other than the compression stockings, which is elastic stockings, to something which is semi-elastic, which is known as a Velcro wraps. And it could include something more concrete, which is known as a lymphedema pump. And now lymphedema pump also has an important aspect of not only for the leg edema, but it also affects the overall health in a different way by causing sequential compression in the lower legs, improving the flow of the legs, improving the immunity in the legs, not only decreasing the edema and the skin changes, but a lot of other stuff. Well, the good thing is that the vein center, we are equipped to treat all of these illnesses together as a team. So, any questions?
Thank you, Dr. Kumar. Our first question is, what treatments are available for edema?
Okay, that's a very good question. Like I said, edema management is a team approach. It's a factorial, involving multiple arms. The basis of management of edema is to know what is causing the edema. First of all, is there edema or not edema? If there is no edema, why is the leg looking big? So if there is edema, we look for the diagnosis. What is treat the underlying diagnosis, and we try to see the patient as a complete. And even if the problem is edema, we make sure we are addressing the rest of the health functions, including management of sleep apnea and all. So we do not do that on our own, but we refer them to the right specialist for that. Now, once we diagnose there is edema, then we go for different type of treatments, and these are done in conjunction with the lymphedema therapist. We are fortunate to have a very advanced lymphedema therapist, Donna Hanna, with us, and we work together on this field. Next.
Okay. All right. Glenn from Chino Valley says, I am what we used to call double jointed in my thumb. Now I notice there's a pocket of fat behind my left knee. Should I be concerned that I have lipedema?
Yes, you rightly pointed out, when there is something that we call knock knees, or you feel like the knees are like the knees are coming together and then the legs separated down, that's something we call knock knee. If there is a distribution of adipose tissue or fat in the body, which is more in the thigh and the legs and spares the feet, if it is more in the hips and it's less in the waist area, and if it's most importantly, if it runs in the family, if your sisters or mother, all of them, or grandmother, all of them have a similar torso, it's more likely that it is a lipedema.
Okay. Let's see. Susan in Prescott Valley says, my legs only swell when I travel. My doctor gave me a water pill to take that day. Is that okay?
That is an excellent question, Susan. I would say, okay, let's travel less, but that's not the answer. So traveling is fun, and this is one of the common thing that I hear from many of my patients, that my legs hurt so much, there's so much of discomfort that I actually stopped traveling, which is something I used to enjoy. And many a times in the retired elderly population, one of the ways to keep up with everything, and one of the important thing that people do together is traveling. And traveling is fun, definitely. So what happens if the leg only swells during the travel? So basically, whenever we are in one posture for a long time, so if you're sitting like this or standing all the time, like in teachers or anybody whose job, bank tellers or some profession like that, so basically the veins are at the maximum stress because the blood is supposed to flow from the feet up towards the heart against the gravity. If there is an underlying vein problem, which means there is an issue with the valves in the vein, the gravity is not a good friend. So the swelling will happen if we are in one posture for a long time. So traveling is one of the problems where the legs are in one posture for a long time. That means there is an underlying chronic venous insufficiency plus minus lymphedema. It should be diagnosed. More importantly, it's a risk factor for having blood clot in the legs. So if the legs swell during the travel, it's important to recognize it, go to your doctor, get it diagnosed. And also during the period when you're traveling, you want to make sure that you get up and walk, you move your legs, do some feet exercises, and wear a compression socks during travel to make sure that you don't get any blood clots in the leg.
Good advice. Okay, let's see. We've got Tom here says, are there things I can do to prevent the onset of edema?
Okay. To prevent the onset of edema, well, it goes back to what should be causing the edema. That's looking for things like if somebody is obese, it's important to lose weight, eat healthy, and there is more than 70% chance that after a few years, one is going to get edema if they're obese in the long run. So the second thing is if somebody has high blood pressure, diabetes, they are the precursor of having heart failure in future. So heart disease is again important to recognize that is also one of the reasons of having swelling in the legs. So if you want to prevent swelling in the legs, you want to fix everything that can cause swelling in the legs. Make sure your medications are appropriate. They do not cause swelling in the legs. Make sure there is mobility. You're walking and doing daily exercises. If not daily, 3 to 4 days a week, 40 to 45 minutes a day. If there is an issue of the mobility, find a way to fix it, like back pain. And like if there is a knee pain, there are definite specialists available who can handle mobility issues. And even if one cannot walk or do exercises, it's important to understand that simply doing feet exercises when you're sitting on the couch, keep your legs elevated, feet exercises, that may improve the function of the circulation in the leg, causing to less edema. So more important is to diagnose it, and definitely it's important to think of all the reasons that can cause leg edema and prevent its formation in future.
Okay. Let's see, Joan she says that my mom has diabetes and is on insulin. Should her edema be managed differently because of her diabetes?
Okay, diabetes is very common. In fact, diabetes and venous insufficiencies are almost equally common. Diabetes is very popular as it affects in different systems of the body. Diabetes decreases the immune function, causing recurrent infections in the feet that can cause different type of ulcers in the leg, leading to infections, deranging the lymphatic function. But in general, what is most important in diabetes is to have a feet examination done periodically. It's not only the eye examination, feet examination is equally important. So self-examination of your feet is important. So sometimes a little crack in the skin, a little nail infection in the sides of the nails, or a little blister, that can lead to a more infection in diabetes. As far as edema is concerned, edema is a good precursor for infection. So if you have diabetes and leg edema, you're very prone for recurrent infection in the feet. Otherwise, edema is treated the same way as non-diabetic.
Okay. Let's see. Tom says, does edema run in families, or is it more connected to your lifestyle and medical conditions?
So, Tom, edema definitely runs in the families because chronic venous insufficiency runs in the family. If two parents are affected, there is more than 94% chance that you're going to get it. So it runs in the families. It's one of the thing that could be related to the genes. It is definitely related to the genes as well as to the lifestyle that also runs in the family. So edema, other reasons of edema, for example, lymphedema, they can have some genetic component. There are some other reasons like lipedema definitely runs in the family. Not everybody in the family will get edema, but it is something, if one person has leg edema, it's important that the other person also start thinking that in the future they can also get it.
Okay. Diane in Prescott says, what do you recommend for skincare for someone with early leg edema?
Okay, go to Donna Hannah. She's the best. That's what I can say. So the lymphedema, like we talk about, the skincare is one of the most important aspects because otherwise it keeps getting infections, which further deranges the lymphatic function. So for the skincare, it's important to make sure it's not dry, there is no crack in the skin, there is no breach in the skin, any blister that comes up should be addressed right away. If you're doing the right compression therapy, it basically takes care of the skin also. And if there is any redness on the skin, it's important to go to your physician and get it diagnosed quick.
Should I wear compression stockings after the swelling has gone down in my legs? What other tips do you have for wearing compression stockings?
Okay, nobody likes compression stockings and I get it. So it's like basically a feeling that it gives, that as if your leg is constricted, it's tight, it's stopping the circulation, it's cutting off. None of that actually happens in general unless there is an underlying disease in the arteries, which we can see in edematous leg in 20 to 25. We always look for it when we start the compression therapy. So most of the time, it's mostly accepting the compression stocking that matters a lot. And there are multiple ways to do compression therapy. Compression socks is not the only answer. The compression socks definitely has a mechanism of action. It needs to be understood that if it is light compression, it will do only light job. If it is not a graduated compression, it may do harm more than benefit. If it's a compression sleeve, that may be one way to handle, but then the edema can transfer to the foot area. So when it comes to compression, it's always good to take help from the expert. And when it comes to managing the socks, the compression socks are available in different type of sizes, shapes, texture, and different materials, different vendors, and different compression levels. So when it comes to choosing the right socks, most important thing is sizing of the socks. And when it comes to sizing, we try to size mostly the ankle and the mid of the calf, and based on that, we try to do a size at the vein center. If the size is not appropriate, it may feel tight, or it may feel very tight, or it may feel very loose. So it doesn't do any good either way. So sizing is important. When you're wearing the compression stockings, it's important to see that if you have issue with the hand joints, or if you have issue with the back or the knees, difficulty to bend, then there are different help available. There's something known as doning device. And these devices are available very cheap in the market. They're like $30, $40 each, but they go a big way to help wearing the compression socks. If there is any question, just come to the vein center, and the vein clinic nurses, they're very educated, they're very trained to help you all for this purpose.
Fabulous. Let's see, Jody would like to know about massages. She says, do massages help leg edema, and how often should it be done? And are there people who specialize in this kind of massage therapy?
Well, that's a good question. I think massages help everyone, even if there is no edema. It makes us feel pampered. It makes if there is any stiffness in the legs, go away. So there is no side effect of massage. A massage is basically helpful in edematous legs, mainly to improve the lymphatic function. It's actually one of the key therapies in lymphatic therapy other than compression therapy. So when we massage in the legs, we are actually improving the flow of the lymphatics from the feet up towards the heart. So it's a good thing.
Oh, more massages.
The more the better.
The last question I've got is, I like my evening walks, but in the past year, my ankles are swollen by the end of the day. Should I change my walking routine and elevate my legs in the evening?
Okay, so walking is one of the best activities that we can do. Almost most people are able to do, and it's an important exercise. Not only the function of the circulation gets better, every circulation gets better with walking. Arterial circulation, venous circulation, lymphatic circulation. It also improves the overall feeling that we get with walking, the type of the being in the outside, being in the nature, being decreasing the body weight, increasing the mobility. All of them, there's a good things about walking. However, if there is an underlying vein problems, valve of the veins problem, what happens is that if you're on feet a little longer than usual, the blood tends to pool in the lower leg. So it's important if there is somebody gets walking at the end of the day, gets swelling in the legs, and after being on the feet a little longer all day, it's important to wear a compression stocking and walk. That actually becomes a very good a combination to improve the overall function of the leg. And so if you're wearing a compression stocking and sitting, the pressures in the leg are also held, but not to that extent when you're walking or doing feet exercises and wearing the compression. So that's an added benefit.
One more question. This just came across from Anna. She says, I have started to have small, hard bumps appearing on my legs. They are often painful. I pick them or pop them, and they are very hard, almost calcified. Once I have removed them, they bleed profusely. It takes almost a month for the small sore to heal. Is this something that should be checked out?
Definitely, if there is something in the skin, in the lower legs that bleeds easily, should definitely see a primary physician or a dermatologist or to a vascular specialist. So it's a difficult thing to diagnose unless you actually visually see it. So it could be anything. If it is a swollen leg and something that keeps popping up and bursts like a oozy and like a glue-like thing, then it's most likely related to underlying lymphedema. However, if there is something that bleeds, that needs to see a dermatologist for sure.
That's all I got.
All right. Thank you very much for attending Healthy Conversations.